Gotta get Gotta get I hope that someone gets my goddamn
The American families ought to realize a very important fact, and that is every single member of the United States Senate, with the exception of one, has comprehensive health care, and our children are covered. You understand, America? All of our children are covered. All of our children are covered. And next, Mr. America and Mrs. America, your taxpayers' money is paying for 72% of our health care coverage costs. Do we understand that? Now, for those that are saying, well, I'm not going to support this because it costs too much. I'm not going to support this because it may be 300% of poverty. We get paid $160,000. We are well above the 200, the 300, the 400% of poverty level. And yet we're going to have members on the floor of the Senate this afternoon who are going to turn thumbs down to American families that are watching the debate and discussion and knowing that our premiums, our health insurance is being paid for by the American taxpayers. I wonder how people do that, myself. I wonder how they do it. You think if they're so offended about federal government spending or a federal government program that they wouldn't use it themselves. But no, they do. They'll take it. But when it comes to looking out at working families, there are going to be many in this chamber that are going to say, no, we're not going to look out at working families. You can pay for mine. Go ahead and pay for mine. Mr. President, this is extraordinary hypocrisy that we are about to see here on the floor of the United States Senate. How can people in good faith do this and still accept the federal government? How can they be complaining all afternoon about a federal government program and then have a better federal program paying for their own? Paying for their own. The most important point has been mentioned eloquently by many of our colleagues as the importance of covering those children. The important point is that too many parents will cry themselves to sleep tonight wondering whether their child is $200 sick because they have to go to the emergency room. That is the heart of this. This is an issue of priorities. I believe we ought to invest in the children. And I think we have benefited enough here in the United States Senate from our own largesse, from the federal taxpayers in terms of the supporting ourselves, that we should be ashamed if we cannot see the responsibility that we have to look after children of working families in this country. I thank the Chair.